N95 masks are masks that are specifically used generally in the healthcare environment, and they can be used even when providers are in the room with somebody with COVID-19 infection during an aerosol generating procedure. So they protect not only against the large respiratory droplets that can be transmitted by anybody with COVID-19 infection, but they also protect against the very tiny little droplets that can travel further distances. And we tend to see those only when patients with COVID-19 are having aerosol generating procedures. So when they're being intubated, for example, or having other procedures on their airway, that can create these tiny little droplets that can travel further. The trade-off for the N95 respirator is that they have to be fitted to the wearer. So the wearer has to have a fit test to make sure the N95 respirator is fitting appropriately and performing appropriately so that it has a good seal. And again, for that reason, you tend to see it only in the healthcare environments where that fit testing can be performed. They can be uncomfortable if they're worn for a long period of time because they have a very tight seal. Again, you need to have more of a seal when you're trying to protect against these smaller droplets that, again, fortunately we see only very rarely, again, when COVID-19 patients have aerosol generating procedures.